Hi, good morning, Collins. My name is Mihiraa. Let's start the warm-up session. Describe your typical working day.
My day starts with prayer. After completing my daily routines, I reach my workstation by 7:30. Before taking the handover, I complete my inventories and update the crash cart medication and dressing trolley. After receiving the handover, I interact with my patients to identify their health needs. Based on my assessment plan, a nursing care plan, and provide quality care for my patients. Afterward, I assist the physician in his work and carry out necessary clinical orders. Meanwhile, I find some time to interact with my colleagues and maintain a good rapport with them. My duty ends by 3:30 after I give a handover to the next scheduled staff members.
Which is your favorite destination? Why?
My dream destination is Australia. The first and foremost thing is that Australia has a world-class healthcare system, and I can be a part of it. Secondly, the country has a better standard of living and economic and political stability. Besides, here, nurses are paid well and respected too. In addition, I have many friends and relatives over there, so they can help me during my initial days.
Why did you choose OT?
It is my long-term ambition to work as a registered nurse in any English-speaking country, such as the UK, Ireland, and so on. To meet the requirements to register as a nursing professional there, I need to prove my English language proficiency. Hence, I chose OET to fulfill my dream. Moreover, OET is tailored according to the needs of nursing professionals. Therefore, I believe I could perform well in this test.
What are the current trends in your profession?
Nursing is a dynamic profession, and changes happen daily. Nowadays, technology plays a vital role in my profession. For instance, paper records that we used in the past have been updated to electronic records. Besides, at present, we are following evidence-based practice, which means there is a scientific rationale for every procedure. Moreover, in the present day, a nurse can function as a nurse practitioner, which is equivalent to the position of a physician.
Are you comfortable working with other doctors and nurses?
I find I work well under a variety of conditions and circumstances, and I take pride in my flexibility. I enjoy working in a team because I often find that different viewpoints can help me find solutions to a problem I might not think of on my own. I also enjoy self-motivating and am equally comfortable working alone.
Your preparation time is over. You can now start your role play.
Hello, Mihiraa. Please come in and have a seat. I can see that you're feeling quite upset, and I want you to know that it is completely understandable to feel this way. A new diagnosis like this brings a lot of change, and your feelings are very valid. My name is Collins Colford, and I'm one of the nurses here. Today, my main task is to talk with you about your celiac disease. I'd like to start by understanding your concerns better. Then we can go over what the disease actually means, and finally, we can look at some practical ways to manage it, especially when it comes to eating out and your social life. But first, I'd really like to hear from you. Can you tell me a bit more about what's been going through your mind since your diagnosis, and what you understand about it so far?
It just feels like my whole world has been turned upside down. I keep thinking about my friends and how we always meet at our favorite restaurants. I feel like I'm going to be a burden, always asking for special food, or that they'll stop inviting me because I can't eat anywhere normal. It's not just the food, it's the feeling of being left out. I also don't really understand why this happened. Is it an allergy? My friend said it's just a fad diet, but the doctor said it was serious.
Mihiraa, thank you for being so open with me. It is perfectly normal to feel anxious about your social life and to worry about being a burden. Your feelings of isolation and sadness are very real, and I want to assure you that we will address all of that. Now, let's first clear up your understanding of the disease itself. Celiac disease is not an allergy, and it is definitely not a fad or a choice. I want to explain it in a simple way. Think of your small intestine as a very special carpet that absorbs all the good stuff from your food. When you have celiac disease and you eat gluten, which is a protein found in wheat, barley, and rye, your body's immune system gets confused. Instead of just digesting the food, your body sees gluten as a threat and attacks it. This attack damages the surface of that special carpet, which is the lining of your small intestine. When that lining is damaged, your body cannot absorb the vitamins and minerals it needs from your food, and that can make you feel tired and unwell. So, it is a serious autoimmune condition where your body is reacting to gluten, and the only way to stop that damage is to completely avoid gluten.
I see. So it's not just a trend. That makes me feel a little better that it's a real medical thing. But how can I ever go out to eat safely? I'm scared of getting sick accidentally.
That is an excellent and very important question, Mihiraa. It is absolutely possible to dine out safely, and we can talk about practical strategies to do that. First, it is always a great idea to research menus in advance. Before you agree to go to a restaurant, look up its menu online. Many places now have gluten-free options clearly marked. You can also call the restaurant ahead of time during a quiet period to ask specific questions. When you are actually at the restaurant, the most crucial step is to clearly and politely communicate with the chef or your server about cross-contamination. This means explaining that even a tiny crumb of gluten can make you unwell. You can ask if they have a dedicated area for preparing gluten-free food or if they use separate utensils and fryers. For other food selections in general, always look for products with certified gluten-free labels on them when you shop, as this guarantees they are safe. Also, there are many dedicated apps you can download on your phone that are specifically designed to help people with celiac disease find safe restaurants and products. Local support groups are also a fantastic resource, where members share their own experiences and recommendations for safe places to eat.
That's a lot to think about. It still feels so restrictive. What about my friends? How do I even explain this to them without it being awkward?
Mihiraa, let's think about this from a different perspective and offer some alternative social framing. Instead of seeing it as a restriction, you can reframe it as an opportunity. For example, you can host gluten-free gatherings at your home where you have complete control over the food and everyone can enjoy a delicious meal together. This helps you focus on the social company rather than just the food itself. When you are out, remember that the main reason you are with your friends is to enjoy their company and share experiences, not just to eat a specific dish. Also, a wonderful strategy is to explore naturally gluten-free cuisines. For instance, authentic Mexican food that uses corn tortillas or many South Asian dishes that are based on rice and lentils are naturally free of gluten and are delicious. There are so many options, and this can be a great way to explore new foods with your friends.
That actually sounds a bit less scary. It's nice to know there are options. But will I ever be able to just eat normally again? I feel like I'm missing out forever. I completely understand that fear of missing out, Mihiraa. Let me reassure you about your diet options. The good news is that the range of delicious and safe gluten-free options is continuously improving. Supermarkets and restaurants are becoming much more aware and are offering fantastic products. You do not have to navigate this alone either. I strongly recommend seeing a specialized dietitian who can help you create a balanced and enjoyable meal plan. They're experts at making this transition much easier. Additionally, there are local celiac support networks that are filled with people just like you who understand exactly what you are going through. They can offer friendship, advice, and a sense of community. You have a whole team to support you.
Okay, I feel a bit more hopeful now. Thank you.
You are most welcome. To summarize our discussion today for clarity, we first acknowledged your very real social anxieties about feeling isolated and being a burden. We then clarified that celiac disease is an autoimmune reaction to gluten that damages the intestine and stops nutrient absorption, and it is not a choice. Next, we covered practical strategies for dining out, like researching menus, communicating with the kitchen about cross-contamination, and looking for certified labels and using apps. We also talked about alternative social framing, such as hosting gatherings and focusing on naturally gluten-free cuisines. Finally, I reassured you that diet options are improving, and you have the support of a dietitian and local support networks.